Hello all, this is Szuch, registered nurse. You may remember me from such films as Professional Report and Elevator Speech. Today, obviously I'm here at the hospital to talk to you about workplace conflict in a professional medical setting. Now, anytime that you have a medical setting, you inevitably have people. People and their interactions end up being the source of most of the conflict. As it turns out, in a hospital, there's people everywhere. From the doctors that you may work with, to your coworker nurses, your supervisors, the assistants and techs that you may have to delegate responsibilities to, and let's not forget, your job are people. Don't forget about the patients. These people are here, they're not in a very good mood, they're almost never feeling right, and sometimes they're going to take it out on you. So one of the best ways to avoid conflict, according to Michael Ramsey stated in a 2001 presentation to the Baylor University Medical Center, that the best way to prevent conflict in a hospital or a medical setting is to have a professional code of conduct. Now, a professional code of conduct will lay out to everyone involved how you're supposed to act on a day-to-day basis. The intention is to prevent conflict, but it's also a map of what to do in the event that conflict does occur. It is laid out certain rules for conflict resolution, such as who to speak to, how to act during conflict, and to speak with the supervisor who can arbitrate the situation to a successful conclusion. Now, violence in the workplace, certainly you don't expect this around your coworkers. It could occur. If you do follow the code of conduct, though, you shouldn't have any violence. But in a medical setting, you run into all sorts of people. Violent types can be from, in regards to patients, can come from mental illness, can come from substance abuse, and a lot of times, and most commonly, it's in our dementia patients. If they're losing their memories, sometimes they may misinterpret what's going on. Not having any idea how they got in the hospital, they may think of it as a prison, and they may fight accordingly. In this situation, the best thing to do is to simply make sure the patient is safe, but to step away. You want to keep yourself safe and keep the patient safe. Conflict resolution is going to be talking down from this, but also stepping away. And don't forget to get help. Remember, no matter what's going on, it's your job to stay professional. Somebody else may be assaulting you, may be yelling at you, may be saying bad things. You need to just breathe. Take a breath. Like your mom said, if you don't have anything nice to say, don't say anything at all. Your first instinct is to react poorly. Don't react. Take a step away from the situation. Move yourself before you dig yourself into the same hole. Find a supervisor. Find someone who can help come to a peaceful resolution. If you can speak, well, try to come to some sort of compromise between the two of you. In any sort of conflict in a professional medical setting, you're going to have to set up a report. A lot of times with a coworker, if it's just a simple disagreement that can be talked out, there won't be any report necessary. But if it is with a patient, whether it's a complaint about the food or if it's a complaint about you, there's going to have to be a incident report filed. So when you're filing a report, just like the charting, just the facts, man, keep it simple, keep it concise, leave your emotions out of it, and be completely honest. Remember to proofread with the same guides in mind. A lot of times you may think you're being completely impartial, but after reading through a couple times, right after an event, it may still read a little bit. Emotion. Learn from your mistakes. Your experience is the absolute best teaching tool you have for what to do in a conflict situation. You know how you react. You know how to avoid this conflict to begin with. You can see how things are going forward. You can see what saying or what they're saying may make this a very potentially dangerous situation. So stop it with your words, stop it by walking away, diffuse the situation or avoid it altogether by following through on your commitments, your promises to others, make sure you do your job, and approach people with professionalism when you do have an issue. All right, thank you very much. We're going to open things up to questions, and we'll see if there's anything that I can do to help out. Have a great day, everyone.